Thanks for coming, you guys. We're here to have this really cool panel on research funding, especially with community-based organizations. So my name is Megan McClelland. I direct the Hallie Ford Center here at OSU, this building, and I oversee some of the projects in it. And one of those I get to do with really great, amazing colleagues called the Aspire Children's Environmental Health Center grant from NIH, and it focuses on children's translating the research that we know works into practice, especially in partnership with community-based organizations, as well as developing new innovations around how we can do this work. So we have different cores of our center. So our purpose today is, so I do want to acknowledge, we have Veronica Irvin, who's here as part of the Aspire Center, Megan McDonald, Dixie Jackson, Nicole Bruner, Andy Larkin, all you guys. We have other students in here, but thanks for showing up, you guys. That was great. I know there's some people outside, which is fine, chatting. So what we're gonna do, and we had a third person that unfortunately had to leave town for a family emergency, so they couldn't be here. But really what this is about is really in a pretty dynamic and changing, rapidly changing funding environment, like what are we doing to be creative, and also hearing from folks in the field that are experts in that kind of work and what they're doing there. Like how are you guys making it work and being creative and getting the work done? So we're going to look at funding insights and strategies for community partners. We also have a bunch of pilot grantees that might be on Zoom that we have funded, like the City of Ashland. We funded a whole bunch because one of our areas of focus is the effects of wildfire smoke on pollution, and not pollution, but even health effects of wildfire smoke on children, exercise. When is it safe to exercise if there's a wildfire? When is it not safe to exercise? That's one quick example. So let's start by just introducing, if I could ask each of you to introduce yourselves, who you are, who you serve, what your role is, maybe the mission of your organization. That would be fantastic. We have Christine, is it Mosbaugh? Mosbaugh, who's a strategy and community engagement manager at Community Health Centers of Benton and Linn County. And then we have Michael Couch, is it Couch? Right, sorry. Michael Couch, the executive director at Crossroads Community. So thank you for being here. Christine, let's start with you.
Sure. So I currently work at the Community Health Centers of Benton and Linn counties. I've done a lot of things there. Communications and strategy work and engagement and partnership is sort of where I've landed. That doesn't summarize itself into a title very nicely. So I just know that I do things that help support our organizational goals and mission. Community health centers are many communities referred to as safety net providers. They have been around for 60 years, really have a social justice, a war on poverty, civil rights era origin story that we really try and bring forward to today. So we are absolutely providing primary care, dental, and behavioral health care. And we are also trying to bring all of the social elements and the structural pieces in folks' lives that make it hard for them to achieve health outcomes and bring those into one place. We uniquely do that in this area as part of local government, which is not the most common way to do this. Usually community health centers run as nonprofits, but we're connected to Benton County's local government, and then we have agreements in place to do this work in Linn County. So that's where I am now, and that's kind of why we do that. We, as part of the government connectedness we have, Benton County Public Health and Linn County Public Health are absolutely partners of ours, and really trying to figure out what the whole system can look like to help support people, because we know we have one angle and one opportunity, and they have a lot of others through programs they run. So we have a lot of relationships with them directly and intentionally. And so we try and leverage that as often as we can. But our goal is to help people be healthy as individuals and be in their community and really participating in the way that they want to.
Welcome. Michael.
My name is Michael Couch. I'm the executive director of Crossroads Communities. As for what it is we do, our focus is providing supportive and stabilization services for vulnerable individuals and families in rural Oregon. We are housed and focused specifically in Lebanon, As of last year, we expanded into Marion County. The beginning of this year, we expanded to Benton County, and this summer we'll be expanding into Polk County. As you can tell, there's a lot of need for services in Oregon. I think probably the easiest way to explain what we do is to, if you've ever been in a position where you've been standing in a whole ton of mud and both of your feet are really stuck, you could spend some time trying to pull one leg up that just digs the other leg deeper, and then you try to pull the other leg up, and all the progress you made for your first leg is gone. We're the board that comes in that provides you a stable foundation to lift up.
That's great. Thank you. So let's start with a few questions. I'm really curious to hear about how you've gotten funding maybe in the past, the agencies that help provide the funding to do the work that you're doing to disseminate out. So give a few examples of the agencies and maybe sources. And then how do you find it? I mean, I think we get lots of questions from students, or we're trying to do this work in ways and they don't know where to find funding, for example. So, we hear this a lot from our pilot grantees and community partners as they try to navigate, all this always changing landscape. So, Michael, do you want to start first?
Certainly. My background is in banking and finance. I knew the area. When I left banking about 10 years ago, I went into independent advisory services. So I've been writing grants and helping small businesses and nonprofits for a decade now. I think probably one of the best places to go if you're looking for foundations is someone who knows the industry. I could probably rattle off a half a dozen foundations that are a go-to for any nonprofit organization. They'd be different than for a for-profit or for a government organization. State agencies, Crossroads Communities got our start with Oregon Department of Veteran Affairs. At that point in time, we had a $1,400 a year operating budget. They gave us our first grant for 5 digits. Shortly thereafter, Oregon Health Authority, because the focus we do on social determinants of health and stabilization, they gave us our next grant for 6 digits. Since then, Oregon Health Authority has been a great partner. ODVA has been a great partner. Oregon Housing Community Services, we do a lot with housing. I think this coming year, we're going to have an operating budget of $2.8 million. Not bad for a 5-year difference.
Wow. In 5 years? Mm-hmm. That's a lot. That's great. You go.
We have our base grant for the healthcare services and the behavioral health and dental services that we provide comes actually from the federal government. So from Health and Human Services, HRSA, Bureau of Primary Health Care, all these people, big acronyms that are all changing right now. But we have kind of a base grant. It's not a whole lot of money, but that is really sort of our foundation. And it allows us to provide care to people who we wouldn't otherwise be able to see. We have also some money for migrant seasonal agricultural workers specifically. And so there's a couple of funding streams that just kind of amplify the work that all community health centers do. So because of that connection, we do have other opportunities outside of our base grant to bring in other services. So expanding behavioral health, the one that we just got in December has to do with, it's a quality improvement fund around justice involved people. So making the transition from within 90 days of release from a jail setting or a carceral setting to the community, really looking at how you can connect to health and continuity. And so start that maybe before, but certainly connect it afterwards. So we get opportunities like that we definitely hear about and are eligible for because of our federal connections. And we anticipate that most of those will continue, but the amount and frequency will likely change. Things that we have right now seem like they will stay in place. Our fingers are crossed most days. But, the other place where we get grant money at this point really has to do with, like Michael said, kind of knowing your industry and who's playing and paying in those spaces. So for example, a couple years ago, I had been going to Intercommunity Health Network Coordinated Care Organization, which I will now call IHNCCO. That's the folks who, operate Medicaid in our 3-county area. And so they have this space where they take some quality funds and then they put them into a pot and they say, hey, community partners of any type, size, background at this point, if you can tell us how you impact the health and well-being of people in Linn, Benton, and Lincoln counties, we'll consider through a competitive process funding you. And so I had written an opportunity for some food as medicine funding, and then there's a community partner, the Corvallis Environmental Center, who wrote a very similar grant proposal, and IHN said, hey, because they offer technical assistance, can you two work together? And if you can, we'll fund you at, your combined rate. So we did that, and that was a really great way to get some funding. And it was because we knew who was playing in the CCO space. We had been going to these meetings. Delivery system transformation is the space where a lot of this comes out of. And then at these meetings, Michael and I used to actually co-chair a social determinants work group. You just get a lot of people who are kind of curious, mingling. And if you or the organization can support some of that mingling, you also then can cross-purpose or, cross-pollinate your needs and objectives and learn about other industries. But whether it's because you're directly connected and like HRSA sends us, the Health Resources and Services Administration sends us something and says you could apply for this if you wanted, or because we're in orbit with other people, I think both of those have been really useful ways that we've connected to grant funding.
So like building the network, a lot of this seems so, a lot of times when we apply for grants, it's like a federal or, it's less, but networking is still important, but a lot of times it feels like this is more local funding, like within Oregon, but you get some federal too. So I guess so building the networks is really coming from like groups and meetings that you go to and.
Yeah, and I think healthcare and health, they can be the same thing, or we can talk about them separately, but so much of what we know is going to make one side or the other, and then our whole communities healthier, are so integrated anymore, right? We know that people need to go to a doctor and have services and medication and access, and we know people need to live in communities with fewer barriers and more opportunities, and folks addressing like structural and social things that are happening. And so I've worked in healthcare for about 20, 25 years. That really is the only way forward. And I will admit I've always worked in sort of safety net healthcare spaces, never for-profit hospitals, but which might feel different. But in that safety net space, we just acknowledge that like we can't do all of this. And the thing that was so great that we learned about the food VeggieRx program was that we don't have to become good at providing food or resourcing local farmers or even like having SNAP benefit EBT machines. We don't need to know any of that. We just need to find a partner who does, because what we know how to do is what we should focus on doing. And so I think a lot of it happens out of necessity, quite frankly, that we are never going to be able to do all of the things, but we know who we could work with.
Well, that was my next question, right? A lot of this is because sometimes you could get to this space where, okay, you feel like you have to compete for some of the same small pot of money. Yeah. But so my question was really about partnerships and collaboration, and it sounds like you've used it really effectively to also go after but like find ways to each do different things, but also access funds that way to deliver services. Is that, how does that work for your organization?
Absolutely. First and foremost, Crossroads Communities is more about administrative and logistics. We don't run a lot of our own programs. If there's other programs out there, we connect them. In the last 5 years, Crossroads Communities has brought about $40 million of funds into Linn County. We haven't even used 6 of it ourselves. The idea is if you have the partners and you're able to put the coalition together, you will stand much better on a competitive grant. If you say, these are all the people we're working with, we've created a coalition, we already know what we're going to do, and we each have our own area of expertise. This is what the entire continuum needs. We're going to keep this much, this partner gets this much, this much, this much, this much, and everybody gets funded, and you can do a lot more together than you can separately.
I think it's just an interesting model to me, because it also speaks to, I think sometimes in funding scarcity, what we find is that people retrench they go to their corners and they become very protective. But what you're saying actually that's been really effective is like building out your networks and like finding good friends who they can each do different things. This applies in academics all the time. That's what we do a lot here is we find, and that's actually the part of my job I think I like the best, is like finding good, cool, great people who are doing awesome stuff, and how do we bring them together and all have a piece of something. But it leads to more innovation, frankly. It leads to more success. And it certainly sounds more effective.
As a grant writer who has also done grant review,
Yeah.
I can tell you from experience that nothing signals a death knell to a grant application is having another applicant in the same area applying for the same funds for the same purpose without you even acknowledging each other. That will sink both of your applications. Because
Wow.
state agencies and private foundations are looking for collaboration. They do not want to see siloed projects.
Yeah, I was going to comment that I think a lot of the process that I am engaging with at this point in the last, I'll say 10 years, it asks you, who are you collaborating with and how will you sustain this? And in asking those two questions, it's almost never on my own by myself. And so it's kind of forced to those conversations. In a previous life job, I worked at a children's hospital and did a growth and development study that was through NIH, National Institutes of Environmental Health Sciences, NCI, National Cancer Institute. So big players in an academic medical setting. And even then, so I can kind of put that hat on and think about what it felt like to compete and have scarcity, which it did. I mean, these were like longitudinal 10-year studies that we were part of. But what actually helped there, which is the same concept, is that they required that we collaborate with a group from New York City and from San Francisco, and I was in Cincinnati, Ohio at the time. And they were like, here's the deal. We'll fund you all. You do very different things for very different ends. You also have to talk to each other, and you have to come together once a year, and you have to have these summits, and we're going to talk about what you found, and we'll bring in external people, and you'll have learning opportunities. But I also have found that when grant makers or the federal government or the state or local government want to also add that learning collaborative piece on, it does also help you do that. You wouldn't go out of your way potentially to do it because you'd be focused on the project in front of you, not on the work to be done. So even at that higher level with a lot of federal, national academic spaces, that was really helpful. And I see it echoed really differently in local community, but it's conceptually very similar.
Yeah. Oh, I love that. That's super. Okay, I wanted to, I don't know if we got this already, but can you talk a little bit about your experience getting funding? And I mean, you've talked a little bit to this too, like some of it requires partnerships and collaborations. I'm curious about how do you get your funding at the different pieces of it? Like some of it is required for, I'm kind of curious if I could ask Michael about like yours seems a little bit different in your organization. It seems like you're a flow through or a connector.
When we come up with programs, our first question is who can we partner with and who has programs like what we're already doing? Can we empower those programs to do it better, or do we need to come in and supplement? Over the years that we've been in operation, we found in this area, transportation is a major need. There's some great transportation providers. Most of them are available for medical purposes or medical related purposes only. A single parent trying to be able to get their toddler who chipped a tooth to the dentist, not so easy. Parent trying to get to a parent-teacher conference, but their car blew up, not very easy. A parent with 3 kids trying to get on public transportation to go pick up groceries, not very easy. Let's come up with a program. Let's discuss program partners, explain why we're different from them, how we connect to them, and let's create a supplemental program. So again, knowing your resources, knowing your partners is very important. Phone connectivity program that we did to be able to help people who had their phone disconnected or homeless youth. There was nothing like that, nothing we could turn to, but we knew it needed to happen. So we built the program from the ground up, and they went to our program partners and said, we have this program. If you need phones, let us know, you will get them to distribute. So again, collaborative again. We did not have collaborators that we could say they've done this and they're going to do it with us, but we said these are resources that will assist us with getting a signal boost so we don't have to do it ourselves. And the program partners got phones they can give out to their clients and not have to pay for it. So it was a win-win-win again.
And that funding, like for the phone, that came from like the state? Or
That funding actually came from IHN, from their Delivery System Transformation Committee. So the idea is...
What is that?
IHN is an Intercommunity Health Network.
Thanks. I was just wanting to make sure.
Yeah, so they're the providers. They organize Oregon Health Plan for members in Linn, Benton, and Lincoln County. So they, as was mentioned, have a program where community partners that serve in one or more of those counties on a yearly basis. It's coming up this summer. If you want more information, let me know. I sit on the community board, where you can apply for funds that are related to health needs. So again, social determinants of health, health-related social needs, and programs that can improve the quality of life for people in Linn, Benton, and or Lincoln counties.
but like super pragmatic, like the phone and the transportation. I mean, it's brilliant. Yes.
Dental-
I've been in that situation.
Dental programs for people that fall through the loophole.
Yeah.
The OHP has some sort of dental, but not all. In fact, one of our program partners right here, we got a grant. We kept a small little portion for administrative, and then the rest goes directly to their services. Another way that we collaborate. We don't offer dental services. We don't have people to do that. We have an amazing program partner that does.
Oh, interesting.
Yeah, and I think sort of on a theoretical, if I think about your question from a theoretical point of view, what I've found has been effective. I think I spent most of last year writing some sort of grant every single month, and they weren't small grants. Sometimes they're small grants and they're local and they're friendly. These were like 90-page federal grant loopholes. I mean, we went after a lot of opportunities and got some of them. Not all of them, but the thing that mattered in terms of feeling like we could have gotten them, or we at least had a good shot, was also being able to tell your story. I would add, I think Michael's echoed this a lot, there's like a lot of humility in this work to say we do great things and we don't do them alone, right? Like this dental program, like our dental team is thrilled to help out, but they're not going to be able to find the space and the population and the exact right time and moment to do the work. But if you can call on us and we can humbly come to you with the skills we do provide, I think reflecting that in our grants has made us more effective. So it's sort of that, real analysis of what you're good at and getting good at telling that story, realizing you don't have to be everything all the time for everyone. I think earlier in my career, sometimes when you would write grants or draft things, it was like, well, let's just say that. I bet we could do that, right? Aspirational, and overstating really what we were capable of. And the successful grants I've been part of are really like, let's scope it to reality. It saves your sanity also, because when you have to report on the thing that you just thought you might be able to do, it's a lot harder, and nobody wants to be disingenuous in that process. Andy, did you have a question? No. I thought I saw a hand go up. I was like, I don't want to not give people an opportunity. Can we talk a little bit about how things are changing? I mean, like, there's just a lot of moving parts, and I'm curious to see how, what you guys, we can certainly talk for length about our experiences here, but I would love to see how it's working for you guys, or not working. I have a lot to say. I'll try and limit it. But, since January, we have had a handful, again, because of these federal funds that we do have. We've had a lot of direct communication with the federal government about executive orders, things that won't be able to be done, things that we should think about that we should stop doing altogether. And so lots of just different weird, obscure messaging, quite frankly, that then, of course, entered us into this period of talking to lawyers way more than we ever wanted to, because we work in healthcare and community services, but needing to talk to lawyers to understand constitutional law and how bills become laws, again, things we maybe haven't thought about since civics class in high school. And I was actually in DC the first week and a half of February for an event that happens every year, Policies and Issues Forum for community health centers. And so we've just spent a lot of time trying to understand the landscape, the changes, and really knowing what to tune into and what to tune out of, and what is just going to work its way through, restraining orders, injunctions, things that actually have happened. And so I think what it's taught us is that we have to not react. We have to observe. We have to catalog. We have to, start thinking about what else could happen. But every time we kind of make plans, I'll give you an example. So like gender affirming care is a thing that we got lots of immediate, really direct language about. And so then we said, well, could we pull that out of scope? And for us, that just means, can it not be paid for by the federal government, right? And then we start working with a partner, and we talk to the county, and we talk to the state. And we did all of that work, and it was really worthwhile work. But in the end, it comes down to what's going to be possible. And we still don't know the answer to that, but things start to look less and less possible to just get out of it, if you will. Like, we're going to have to radically change some things if certain parts of policy objectives and funding changes really do happen. We're going to have to make decisions. And I think what we've talked about is like just coming back to our core. We know at our core who we are. We know that we've expanded, and that's wonderful. And if it comes down to it, we're just going to have to start seeing what we can either creatively do or what we have to pause. There's those lists, I'm sure you've all seen them, of like all these words you can't say. Our immediate thought was like, well, just say different words. We can say different words, or we won't say the word, but we'll do the thing. Yeah. And I just think we don't quite know what all of those forces look like together, but we're thinking about it. It's taking up a lot of time in our brains.
It is. Yeah. I mean, it's very opaque, and it is very reactionary. And so I think, yes, being careful, thoughtful, intelligent about how, you look at all this information, right? My question, if I could ask a follow-up, is then, so say you want to continue that work. I mean, maybe it's not funded through them, through the federal government. What do you do then? Like, are there other sources of funding? Because states are also funded from the federal government. So I guess my question is, like, how do you get creative? Can you get creative as we try to pivot?
I think we're very much still in that process, and it's been really interesting. I don't know how many other people are seeing this, but I would imagine it's actually at all levels, local, state, and federal. We have very clear messaging to us, not clear. We have very continuous messaging to us from the federal government about things. The state is kind of holding firm and saying, this is, affirmed here, it's supported here. The state's supported by the federal government in a lot of places, and so we're just trying to square that, because it would be great if there's state level funding, but if that's still connected to federal, then that's a factor. There's places in Oregon that exclusively do some services that are now being told, like, you won't be able to do these at all. And so those are the people, not that we will lean on in their time of trouble, but probably look to see how they creatively solve those problems. We've heard people say, we'll just ask for community support, or we'll go to foundations. And, maybe that is a route forward. I spent a chunk of my life working in reproductive and abortion care, and so have this sort of federal restriction thing that we've worked through. And sometimes that is what happens, right? Your Planned Parenthoods or your community clinics work completely outside of a federal funding stream. In Oregon, there's always been a little bit of support possible, but I guess there's a space too where we start talking about community health centers are a movement. They've been around for 60 years. Movements have seen hard times. We get through it. Do we know the answer? Absolutely not. But are we committed to kind of staying flexible, pivoting? We were talking about all these words in the back earlier, to ride the wave and see what's there. And I don't want to say that too rosily. I think we also know that there's like real damages and losses possible. So holding both.
We acknowledged are in a privileged position that the only federal funds we've received, we've already used. So we are very solvent. I have 5 basic rules of conduct among my staff, and I always follow them myself. One of them is don't discuss politics, don't discuss religion. So glossing over that, but also acknowledging the situation we're in. What we have found, and the method that I use when we look for grants, is we look for grants where the verbiage itself has exclusionary topics, and we plan for using those funds in as many ways as we can, minus those exclusionary topics. If you look for an inclusionary grant that says these are things you can use the money on, it ties you down a whole lot. But if you say you can use the money for everything except this, it then opens up the world. One of the things that our current focus is on, because we realize that not everybody in nonprofit is in an advantageous position right now, is we have set aside 2 FTE, basically 80 hours a week, that we can co-employ staff. So if we have another nonprofit that's going to be losing 2 staff, if we can have them keep one of those staff part-time and the other staff part-time, we'll pull in the other part-time. That allows us to share resources, share training, share manpower, and lets those people stay in the industry that they have devoted themselves to. So in a lot of our case, because we're in a position where we are stable, our objective is to help our program partners stay stable as well.
I think that's really, go ahead, Sandy.
Could you repeat that first part of what you said about the inclusionary?
Yeah, I know. I always found that fascinating.
So a grant is a contract, and the type of verbiage you'll see in a contract is these funds may be used for this purpose. This usually shows up in an RFP, request for proposal, and they'll say these funds cannot be used for this. If you find a grant that has very, very wide utilization of usage, for example, a grant that we got through Oregon Health Authority to purchase a property to convert to affordable housing for people with severe and persistent mental illness, their requirement was the property must be used for this purpose. For every $300,000 used, you must devote 1 unit specifically for people with SPMI, severe and persistent mental illness, and it must stay that way for at least 25 years. So those were the requirements. What could you use the money for? That purpose. What couldn't you use money for? A different purpose. So that allowed us to purchase a van to transport the people, because a lot of people with SPMI don't do well in public transportation. We could transport them ourselves. It allows us to get everything set up, pay for the repairs of the facility, and the very nice thing was we were able to make that money go further. We now have a 21-unit apartment complex, and the requirement is 9 of those units be used for SPMI. Now, because we believe in working with program partners, we are currently outperforming. Right now, we have 12 SPMI folks there. Every other 12 units, technically we could do anything we want with them, but we're still honoring that it is still affordable housing units, but we've been doing things like being able to assist domestic violence survivors. Everything's still affordable because, again, we want to honor the spirit of that grant, but it gives us the most flexibility possible. That's the same reason why we have the ability with some of our grant funds to be able to support other nonprofit organizations. Offers only available for nonprofit organizations. We couldn't, for example, go help the county or help a for-profit, but for other nonprofit organizations that have a similar mission to ours, we're able to share employment with them.
So the idea is to look for grant mechanisms that provide the most flexibility.
Correct.
And I mean, it's an interesting, I guess maybe we do that implicitly. I guess I haven't thought about it so explicitly, but I think that's a really good strategy. It also makes me actually get to the next one, which is really about like tips, kind of like that would be one. But if you're, one of the things that's coming up, just asking for a friend here, all of us, is, again, we're like diversifying funding. We're trying to be creative and finding new friends. And how do we, so tips about applying for grants and diversifying, like, you're trying to think, especially if you're so focused on like a certain mechanism, like, everything. I have friends that are, have centers that they direct, and all of their funding is federal, and that has been great. And in the past, because for lots of reasons, and really, really, really not great right now, and so I'm curious if you could just talk about some suggestions and strategies. We heard about that one. That's an interesting one. I like, but other thoughts about that?
I think we've mentioned, looking in the space where your either time, energy, or expertise is, and we've talked a little bit about finding friends. And then I would say the tip sort of off of that I've seen work well is that you ask your friends too who they're working with, right? So, and then that actually gives you this opportunity to maybe co-apply or to apply with each other listed as your collaboration and your sustainability plan. So I think, we've been doing some work in a rural community in Benton County, and there's the Roundhouse Foundation and, Rural Health, which is not explicitly who we are, and a couple other places in Oregon that we weren't attached to because we don't have that direct line to them. But as soon as we started talking to the rural community, and we're like, well, where else are you getting your funds? Like, you're asking us to fund from the county. That's fine. We can talk about that. But that's what we know of each other. Like, what else are you going after? So Ford Family and, other places that in old jobs and spaces I've been in, I was familiar with, but it's really easy to get pretty siloed, even in your opportunities for funding within your industry. And I think we've talked a bit about this delivery system transformation and the concept of if you can make an impact on somebody's health, that's a pretty broad directive. And so I would be curious to see as a tip, and maybe it's something to look for, if as other people realize that funding spaces and amounts are reduced, or there's not as much state and federal stuff, if those other, let's say housing, I also sit on a board for a permanent supportive housing organization. So like we as the Corvallis Housing First might look at different things that aren't directly housing, but maybe they're health, and health would support housing because housing makes health easier. So I think that flexibility and that open-mindedness and knowing your friends can be really helpful.
Yeah, it's just the power of relationship.
Yeah.
It's the power of creative thinking. I think we're all doing that kind of thing, but it all fits, and it also probably expands it obviously expands your networks, and then it like helps you even be more interdisciplinary or even transdisciplinary, because you're doing stuff that is like going over here, but actually it might be having a bigger impact overall, right? So it's really an interesting thought. Michael, do you want to add some?
Couldn't have said that portion better.
I know, that was cool. Yeah.
Know your resources is a big one. For anybody that's looking for smaller community grants, Oregon Community Foundation, obviously they're a really great clearinghouse for smaller foundations. Becoming familiar with grants.gov if you're dealing with federal grants. There's no sense going to 50 different federal agencies or government-wide organizations. Just go to that one site and look what you're looking for. Similarly, Oregon Buys, that's the one that all RFPs and all purchase orders go through for the state. Knowing that one's a little more difficult to navigate. So what I usually tell people who don't want to do with that, go to the state agencies that are pertinent to what you're doing and sign up for the newsletters. They will send those RFPs out and let you know when one's coming up. You know, I probably get 12 different notices when an Oregon Health Authority grant becomes available. Same thing with OHCS, Oregon Housing Community Services. If you're looking to get into housing, not only do they discuss their own stuff, but they also discuss federal programs, what the statuses are with those, where the governor's funding is allocated, and what type of programs you can qualify for. The HECC, that's the Higher Education Commission, another really great organization. If you deal with youth, Youth Development Oregon or YDO. I mean, as you become more familiar, you get a chance to meet these folks. Again, a lot of them through friends of a friend, but also making sure that you have a plan that you'd like to apply to a grant. You don't find a grant and then write a plan for it. Most agencies can see right through that because, again, you haven't put enough thought in it to be able to make a good case. If you have 15 different programs that you can utilize without the funding, I'd say you're in a better position than finding 15 different grants you need to write a program for. Because if you already thought about the program, it'll make writing the grant so much easier. In the time I've been doing grant writing, my success rate for connecting programs to grants is about 80%. My success rate about connecting grants to programs is only about 40. So you'll have a lot more success having the program before the grant is available. If you're working with an outside grant writer, make sure they know your program and are connecting with you as well. There's nothing worse than a grant writer that thinks they know your program and they write a grant, you pay them, they're gone, and you realize there's so many mistakes before you submit it.
Yeah, that's annoying.
And I think that goes back a little bit to know your story, which is know your program and know what it is that you're doing. You can speak most passionately and most honestly about those things. And not that that's necessarily, many of us have probably reviewed grants. That's not like a tick box, like, oh, this is a genuine one. But it does come through, right? It does come through in a lot of the things, the stories that people are able to tell, the impact that they can convey to you, that they've already had, that they hope to have. I've done it both ways as well, and it just feels so much better, and it is generally more successful.
And unless it's for a small trust, lead with logic, know your data. A small trust might be more willing to go with pathos or ethos, but if you're dealing with a state agency, they want the data, they want the numbers, they want to know that you know what you're doing.
I mean, and I love this for our students, anyone in the room. Like, this is what we teach our students is like, it's the same idea. Like, what is your question? What is the thing that's most important? Why? What's the rationale and justification? Where's the data to support it? It's much better than chasing the funds. If you chase the funds, that's so much more obvious than if you actually are, a priori in how we come up with your idea, your burning passion, and then figure out something that applies for it. It also goes when we have students look at big data sets. They say, well, I want to, everything is then somehow their entire research is informed by the data rather than what, And so then it doesn't work as well. I think that's a great piece of advice.
Are your goals SMART, specific, measurable, attainable, relevant, time sensitive?
Right. SMART goals, Smarty goals.
And please give your program partners more than a week to get you a letter of support.
Oh my goodness. Thank you for saying that. I mean, it is hard. I mean, we work with school districts and it is unbelievably challenging because they are so challenged.
Provide a template.
Always, yeah.
Fill in your information. I have everything else written for you. You'll get them back 4 out of 5 times. Otherwise, 1 out of 5.
But allow them to also, they have to be clear about what they're we just submitted something last year, and it was like, oh, this is not specific enough to this one district in Oklahoma. Like literally, like that was the feedback. So yeah, and we were getting different state supports, and so yeah, it was you have to do your homework on and do that, be specific. Blended and braided funding. You kind of talked about this with how well that works. I mean, I think it's, on the one hand, there's such pros and cons. There's great pros, right? When you can make it work, you can really increase your impact in delivering services or having an effective program. But boy, it's also difficult if you can't braid the funding the way you were talking about. Or that's the other thing we run into is things, this one goes for this long, and then, yeah, it's like.
And I think as an organization, you're blending and braiding funding and diversifying sources a lot of the time, all the time probably. But what I have found to be the most painful and painstaking effort is when individual people doing work end up blended and braided, because the timing and their purpose and their grant directives can work at cross purposes. And also if one funding ends with 6 months, humans need to be employed is what we know for the work to get done. And when we start really blending and braiding funding to support FTE, which I think is why you see a lot of people saying this shouldn't directly support FTE, or like, what's your sustainability for that? That has been really interesting. This health navigation program with the county has grown quite a bit in the last 15 years, and I newly oversee it, and I'm trying to wrap my head around current realities and how we've done things historically. And, Michael talked about, you started out with a little bit of money and then you grew, and like, we haven't landed in this huge amount of money, but we're feeling pretty okay with some of the ways that this work can be paid for. And at the same time, we start to see like this grant expiring or this opportunity going away, and then you have people attached to it, humans. And so that feels really stressful and dangerous, and like part of it. And also I think some of the structuring that is wise for the organization, if you can keep people out of it. That's a big if, right? That's a big if. That's not easy. That means an organization has to invest in people without those other small pieces.
Because you need the doers, I mean, that's the thing. And you want to keep really good people. And so you got to figure that out. Yeah, go ahead.
The speakers just comment how they interpret braiding versus blending.
Oh yeah.
They have, if it's new,
yeah.
For some of us, it might be nuanced, and I don't know if you have a sense of what one.
When are they different?
That's a great question.
It is a great question.
I hear those words a lot, right? And so I don't know.
Well, I think what I was responding to, I was imagining braided funding, as in like the things come over and now it's one thing. So
you fund one thing. You have different funding sources to do like one program of work, is that right?
Yeah,
Project?
I mean, I think I don't think I have the only answer or even the right answer, but that's what I was imagining. And then blended funding for me is like federal, state, local. We generate revenue, right? We work in these ways. So there's some blended funding that happens there, but lots of interpretation,
interesting.
I'm sure.
Yeah, that's a good question. Yeah.
So braided funding in my world, coming from the bank background, is same type of funding source from multiple directions. So for example, the largest braided funding project I ever did was just a hair over $1 million. And that was using funds from state funds, 3 different foundations, and some of our general funds. Blended funding, on the other hand, is using different types of funding instruments. So for example, grants, low-income housing tax credits, federal funds, personal loan or business loans, and the largest project I ever did on a braided scale was $20.8 million. If you're a blended fund, if you're willing to blend, you can utilize multiple different types of funding sources. If you're just relying on programs that just provide you grants, you're just going to get braided funding. If you get near the end of your project, maybe you might want to open up and blend some other funds in.
I know, it's fascinating. Yeah.
Perspectives.
So we have like 10 minutes or a little bit less. So I want to open it up for questions from you all or anybody who has other questions. I have 1 or 2 more that I can ask, but go ahead, Megan. Oh, sorry. I didn't see. I saw Megan first.
Thank you so much. This was really helpful. I think, Michael, I heard you mention or one of you sharing personnel resources. So like someone's at a 50% FTE with this organization, someone's at a 50% FTE with this organization, or some combination of that, and talking about it really successfully. So I was curious if you can provide more of an example around that. In my experience, I also think that can be incredibly successful and really hard. Right now you have 2 meetings to attend, and you have so I'm just curious. Maybe if you can provide a successful example of that.
So when we first started to look into joint personnel, basically dual employees, the focus was to be able to assist smaller nonprofits that didn't have the capacity to handle HR. So the idea was, because again, we're a logistics administrative organization first and foremost, that's where our strength is and where we started, we can handle those HR components, and then however many hours you wanted the employee for, we just built the flat rate, which would be our cost. That saves them the administrative trouble, having to get a bookkeeper, having to get an accountant, having to run payroll, having to deal with all those messy payroll tax, and lets them benefit from the benefits we offer our employees, which as a nonprofit, we can't really offer a great hourly rate, but every time I prepare my grants, I provide amazing benefits for my staff. So we can help them on the back end, matching 401k, paid time off, mental health coverage, the whole 9 yards. And we're one of the few organizations I know of that will provide full healthcare coverage for an employee that works only 24 hours. So we tack that on directly when we do our grants, because that's where we can help on the back end. And then we can offer that to an organization that might barely be able to pay their employees $16 an hour and doesn't know the first thing about preparing state and federal taxes. We take care of all that. Since many of our program partners have expressed a concern about their staffing, the thought is, well, if it's going to take you a year to get your staff back on hand, let's take over your staff and we'll basically just contract them back out to you. And again, you just cover half of those costs. Again, just makes things so much easier for both parties, because again, that also helps that cross-pollination of skills and skill sets and knowledge. That's really cool. Back when I did it with this organization, they did it this way. We never thought about that. I get my administrator together. Hey, what do you think about this? It's a way to share that brain trust as well for people that are quality that they want to keep but just can't afford. We can help keep those folks moving. And then when our organization passes however long it takes, we just slide the employee back over to them. And that way, when they're back working just for that employee, we have a really great contact with that service provider. And that service provider has a really great contact because they were there. They have coworkers with us.
And you build up your reserves so that in times of scarcity, you have sort of this ability to have this stability that kind of continues those folks.
Our hopeful focus is by next year that the grants that we will have will just be for expanding programs and will be completely self-sufficient. That's where we want to be. So back when I was in banking, I was helping businesses and nonprofits do that as a banker. That's within my skill set.
Yeah, that's great. That's great. Okay, other questions?
Thank you. Is this on? Good. Okay. Right. Okay, good. Well, I think the only thing we can be confident about concerning federal money is that we can't be confident about federal money. And I have a feeling a lot more money is going to be going to law firms than going to actual people who need the services in the near future. But you talk about 90-page grant proposals and stuff like that. That's the kind of thing that DOGE is going after. And when they go after it, they will see no blowback from the public, because the public doesn't like 90-page grant proposals any more than anyone else. And my question is, what can you do with no money at all? I mean, seriously, if you think about it, most state funding is coming from the federal government eventually. It's entirely possible you're going to end up having all these problems and no money to deal with them. And there's a lot of resources out there. For example, unhoused people have lots of spare time, and training them and getting them involved would be killing at least 2 birds with 1 stone. Very handy. Is anybody looking at doing things like that? Lots of retired people in this area who are looking for things to do, some of them with tremendous experience and capability.
So to speak to that point, if you take a look at my 18 staff members, 15 of them have lived experience. Several of my staff were originally Crossroads Communities clients. Once we provided them stability, they decided they wanted to be able to give back, and they asked, "Are you hiring?" And at our growth rate, the answer is always yes. And so they came in, they did a full-on interview just like anybody would. We discussed their lived experience because that's important to us. We have given jobs to, I think we're up to 5 of our previous clients. When we run programs, we end up getting a lot of volunteers. We serve a lot of homeless and houseless individuals. And so what we found in a lot of cases where you have this certain expectation of what someone looks like or what someone does when they're houseless or homeless. And then, of course, there's the reality. And yes, there is some overlap. Some people are like that, but they're the ones that people focus on. The vast majority of people that we deal with are lovely, wholesome, beautiful people that have just hit a really, really bad snag. And a lot of them love the opportunity to be able to pick themselves up. Just when you have a lot on your plate, there's not room for much more. And a lot of people who are homeless, mostly what's on their plate is stress, only having slept 2 hours a night at 30 minutes at a time for the last 3 weeks. Just having the ability to help provide that stabilization once they're past what's going to happen to me today, what's going to happen to me next week, and they can start forecasting what do I want to do next year. You see this huge change, and they become some of the best advocates out there and some of my best employees.
Love that. I know. I was thinking the same thing. I was like, I love that. Thank you. That's great. And I mean, just to also speak more clearly to your question, which when you have no money, what you just said about, if you're strategic and you're careful about how you are managing funds and in doing the programming, right? You then are able to become more self-sufficient in ways that then provide that stability, and it's not so dependent on these federal funds or whatever, state funds or whatever's. And I think that's really, I mean, we're also talking about this a lot here. I mean, I feel like I'm in charge of a startup and I'm like an entrepreneur, and like how can we go and be really creative? And the last thing I want to ask about, and speaking to that, one of the things we've talked about in our group is evaluation services. Because what we're realizing is a lot of these grants require you to evaluate, and we have very strong methodological skills, but maybe now because of staffing, and all of this, maybe nonprofits aren't able to have their own evaluation person. So I guess my question is that something, are you having to do evaluation? You have that in-house? Do you see that as a need still? OSU might be open for business for that. Come to the Hallie Ford Center. I'm like advertising. Like, this is my pivot, because I'm just trying to also be really creative. So I'm just curious if you are required to do those things and if you already have people that do them.
If you have a state grant, you're going to have to.
Yeah, I was going to say, like, that's my thinking, right? But we've heard from people that they may have less capability to do that these days.
So
go ahead.
Again, before I helped with Crossroads, I spent time as an independent business advisor, and I did grant writing. And the rule that I always had for someone who's getting their first grant is, once you get the grant, I'm going to come back and we're going to go over your data tracking. Because I will tell you, 10 times out of 10, if you're tracking as you go, it'll be so much less stressful and you'll have much better data than if you try to scramble to catch up. So that has been the focus of mine since day one. When we got grants at Crossroads, I said, staff, this is the grant. This is what we're tracking. This is why I need it. An average employee really wants to do well, but at the end of the day, they're going to try to find ways to save time because everybody wants something to be efficient. If they don't understand this extra step is in there because of this, they will find a way to bypass that because they don't see the need for it. It's working smarter and not harder. But if the staff have the full details, this is why we track this information, this is why we need this information, because you could just stay employed. That's very, very compelling for them to understand why to do that extra work. I love it when my employees find a more efficient way to do something. We will immediately change those guidelines. But if I want to give my employees that capacity to do that officially, I need to make sure they understand why we do things that way. So I do full staff trainings whenever I'm consulting on grants to make sure that a new organization knows what's expected of them out of the grant.
And just having as part of your normal operational process is a great way to do that.
Yeah, my staff know that the data is going to be right because I'm a very anal retentive when it comes to reporting.
Yeah, healthcare is also full of collecting points, data points, personal points, information. And so we live in a very rich environment. We have lots of requirements, and actually a lot of our data is shared or belongs to people other than us a lot of the times. So it's not so much for us, I think. Are we tracking it? We do track it along the way, but what are we doing with it is a really reasonable question. And the federal government will regurgitate and tell us things back, and they have standards that we have to meet. And so we get a lot of that feedback and work done for some of our programs and for some of the stuff we do. But anything that's kind of innovative or that we've added on or that we're still learning about, I think we would always benefit from a little bit of expertise. We do have quality improvement staff and data services within our structure, but do they have all of the skills that are current, that are the most effective, that are the most efficient? They do a lot of other things. So probably not all the time. And, I think it is an attractive service to be offering. When we talk about being in a university community, we're like, how do we make some relationships and friendships over there? Because there are probably parts of especially innovative creative work that would really benefit from some different analysis than what we can provide. Like, it worked well, it feels good, let's keep doing it, right?
Right. I'm just looking at our time, and that went fast. We're already at time, I think. And right? I think so. Is it at 1 o'clock? I know. Yes. I'm like, holy moly, it's 1 o'clock. Thank you so much for coming. That was great. Thanks you all for being here. That was awesome.